We are having post-operative patient for an egg pickup. This is a basic procedure which is required for a patient undergoing IVF. This is a procedure which is done either under local anesthesia or local anesthesia with a very mild sedation, right? We don't intubate. That means we don't put an endotracheal tube to the patient. Patients will normally recover like how she has recovered within 1 hour of the procedure, even if you have given mild sedation. Now this lady has got 12 eggs. That means her ovarian volume will be good. That means she is a normoresponder. For all patients who are normoresponders, our standard post-operative instructions to the patient is kindly go home in 2 to 3 hours of the procedure. Go home for the first day. You can either be at home if you are a housewife, or you can actually resume office from next day morning. The reason why we state this is the recovery time for an egg pickup is absolutely rapid. We will also give patients approximately 5 days of oral antibiotics. We will give them 2 to 3 days of painkillers, and we will ask them to report to the hospital if there is abdominal pain or abdominal distension. You have to remember there is a complication which happens in IVF which is called as OHSS, ovarian hyperstimulation syndrome. Tough to predict in whom it will happen. Remember, we will always give patients where we have more than 8 eggs a trigger of something called as dual trigger or a GnRH agonist trigger. That reduces the incidence of OHSS drastically, but some women may still develop OHSS. You have to call them, you have to give them in written if there is abdominal distension or pain in the abdomen in the next 24 to 72 hours, they have to report to the hospital. Otherwise, 99% of them are actually going to go to office from the next day morning. Some women are so strong, they're so brave that even after undergoing an egg pickup, all right, they go to office on the same day. Hats off to these women because they are able to have that amount of pain threshold. But I am not standardizing it for all women because every woman, or for that matter, every human has a different pain threshold.